Have you ever really stopped to think about how the food you eat turns into the energy that powers your every single move? It's a pretty amazing process, right? But, like any complex system, sometimes things can go wrong. Today, we're going to dive into what happens when that system gets disrupted. We're exploring diabetes, a condition that's all about how our bodies create and use their fuel. So here's the plan. We'll start with how our bodies are supposed to work. Then, we'll get into what happens when that system breaks down. After that, we'll compare the two main types of diabetes, learn how to spot the warning signs, and finally, look at how this condition can be managed for a long, healthy life. Okay, so first things first. Before we can understand what goes wrong, we have to know what right looks like. Every single thing we do, from blinking to running a marathon, it all needs energy. And that whole energy production line, it starts with the food on our plate. That's right, the everyday foods you eat, things with carbs like bread, rice, even a piece of fruit. Your body breaks them down into a really simple but powerful fuel. And that fuel has a name, glucose. Just think of glucose as the premium gasoline for your body. It travels all through your bloodstream, ready to be delivered to every single one of your cells to keep them fired up and running. But wait, there's a catch. How does that glucose get out of the blood and into the cells where it's needed? Well, that's where insulin comes in. Your pancreas makes this hormone, and its job is basically to be the helper. It's like the key that unlocks the door to your cells, letting all that glucose rush in to be used for energy. It's a perfect system. But what happens when that system gets thrown off? When that perfect partnership between insulin and glucose breaks down, that's when we start talking about diabetes. All of a sudden, that fuel, that glucose, is just stuck in the bloodstream, unable to get where it needs to go. And that's really the heart of the problem. At its core, diabetes is all about one thing: too much glucose or sugar just hanging out in the blood. And this happens for one of two main reasons. Either there's no insulin helper to begin with, or the cells have just stopped listening to it. And believe me, this isn't a small problem. Over time, having all that extra sugar in the blood can cause some serious damage to your blood vessels and nerves all over your body. It can lead to some really tough complications. And that's exactly why understanding and managing the condition is so incredibly important. Now, here's something you need to know. Not all diabetes is the same. The condition is usually broken down into two main types, type 1 and type 2. And the difference between them is all about what exactly has gone wrong with that insulin system. Okay, so type 1 is what we call an autoimmune condition. This is where the body's own immune system gets confused and mistakenly attacks and destroys the very cells in the pancreas that make insulin. So the body ends up producing little to no insulin at all. It often shows up pretty suddenly, usually when someone's a kid, and taking insulin is absolutely necessary to survive. Type 2 is way more common. In this case, the body is making insulin, at least at first. The problem is the body's cells just aren't responding to it the way they should. We call this insulin resistance. And unlike type 1, this tends to develop slowly, sometimes over many years, and the signs can be a lot harder to notice. So look, if you only remember one thing from this section, let it be this. It's actually really simple. For type 1, think no insulin. The body just doesn't make it. For type 2, think ineffective insulin. The body makes it, but can't use it right. That's really the fundamental difference. All right, so whether it's type 1 or type 2, managing diabetes means keeping a really close eye on blood sugar levels. They can swing too high or they can dip too low. So let's look at the warning signs for both. First up, we have hyperglycemia. That's just the fancy word for high blood sugar. This is that classic diabetes problem we've been talking about. Too much sugar floating around in the blood because there isn't enough working insulin to get it into the cells. So when your blood sugar is high, your body kind of goes into overdrive trying to fix it. It tries to flush out all that extra sugar through urination, which of course can make you really thirsty and dehydrated. And since your cells aren't getting the fuel they need, you can feel exhausted, get headaches, and even have blurry vision. Now on the flip side, people managing diabetes can also run into the opposite problem, hypoglycemia, or low blood sugar. This can happen if medication lowers blood sugar a little too much, or maybe if someone takes their medicine but then skips a meal. And the symptoms here feel totally different. We're talking shaking, sweating, feeling super hungry or dizzy, and even confused. It's your body's alarm system basically screaming that it's running out of fuel. And this can be a real emergency if it's not treated fast. I know, these words sound kind of similar, but there's a really easy trick to keep them straight. Just think about the prefixes. Hyper means high or over, like in hyperactive. And hypo means low or under, like in hypothermia. So hyperglycemia is high sugar and hypoglycemia is low sugar. Simple, right?
Okay, so we've covered a lot of ground, and with all this information, we get to the most important question of all. What can you actually do about it? Well, the good news is that diabetes is a very manageable condition. It's all about taking back control of that fuel system.
And this, right here, is probably the most crucial message of all. With an early diagnosis and a real commitment to managing it, those long-term risks we talked about can be cut down, big time. It means people can, and do, lead totally full, active lives. So what does good management look like? Well, it's really a combination of a few key habits. It means checking your fuel levels, using your medication the right way, fueling your body with balanced meals and regular exercise, and staying in close touch with your doctor. And of course, it means really getting to know your body's own warning signs. And you know, in the end, it all comes down to this. Knowledge is power. Plain and simple. Understanding how your own body's fuel system works and what to do when it doesn't is the absolute foundation of good diabetes care. It's what lets you make smart choices every single day. And that kind of brings us full circle, doesn't it? We started by asking how your body turns food into fuel. Now we know what happens when things go wrong. Ultimately, understanding diabetes is about understanding your own body. And the more you know, the better you can manage it. So my question to you is, what's one thing you can do today to learn just a little bit more?